I've been involved with Best Doctors actually since I was a resident at the Brigham and Women's Hospital in Boston, and have continued my involvement throughout my residency and then subsequently through my fellowship and my first couple of years on junior faculty. And when I think a little bit about sort of what I do and why I continue to do it with Best Doctors, I can think of a couple main reasons that contribute to that. And the first, I think, is that this provides me an opportunity, becoming very involved in these cases, to participate in a process that I think really leverages the internet and the intellectual capital of our expert pool to provide really sophisticated consultative opinions to patients who are literally all over the world who are looking for our help. And I think that when we do this, and as I've really become aware of firsthand through the clinical summary process, I think we have a unique opportunity in medicine to really get it right in terms of doing complete data collection and comprehensive reports that, frankly, are difficult for anyone to do in the scope of usual medical practice, and then in terms of the limited time that we have with our patients every day. And the second important reason I wanted to bring up is that I think that this provides really immense intellectual engagement and satisfaction that contributes to my own learning. I'm a practicing oncologist in academic medicine. Many of the cases that I get involved in are actually complex oncology problems. And I think that this gives me a chance to contribute and also to be informed as a practicing oncologist. And I just wanted to bring up two recent cases that might help to illustrate that a little bit. One was actually a review in which I participated as preparing the clinical summary and reviewing the reports for a middle-aged woman who had presented with an ovarian mass, which was found to represent an endometrioid adenocarcinoma. It ended up being correctly surgically staged and then observed. There was an area in a periaortic node that unfortunately began to grow on subsequent scans after chemotherapy. And she ended up undergoing surgery again. She was retreated with chemotherapy, and the case was eventually reviewed through our process by Dr. Arlen Fuller, who had been the head of gynecologic oncology at MGH. And Dr. Fuller reviewed the totality of all the records that have been collected from diagnosis through the time that the case came to our attention, and I think made a couple of very interesting points about how this focus of disease was likely to be residual rather than a true relapse, and based on some of the receptor staining, recommended consideration of both local therapy to the disease as well as hormonal therapy to try to bring her back into a longer remission in a potentially less toxic way. And so I thought that was actually very interesting to me and informed my own learning and hopefully provided a useful service to both the patient and her treating physician. I've also had the distinct privilege to work with some of the real experts in my own personal field in stem cell transplantation and lymphoma, including Dr. Anton at Dana-Farber, who is really a true international leader in the field of bone marrow transplant. And in doing that, I've really had a nice opportunity to work on some very complex cases that have been directly relevant to my own practice and that have helped to inform me of very recent data that's been presented in my field at some of the national meetings. So this has been very enjoyable to me, in addition to what I think is hopefully a very helpful service for the people who are looking for our help.